Hello, this is the case of the epilepsy patient. Here are the exams 12 years ago, those two coronal sequences when patient was about 30 years old, and now the current exam when patient is 42 years old. We have previously described the same finding as we can see here in the left hippocampus that is showing signs of atrophy. It is smaller in volume, as well as on this coronal FLAIR sequence showing the higher signal intensity. This is a very nice sequence, the inversion recovery, very sensitive for anatomical structures that should always be included in the evaluation of epilepsy patients. That is showing here a clear volume loss of the left hippocampus. So the imaging studies are showing mesial temporal sclerosis. You can see the current exam is not such beautiful, but still showing exactly the same situation with gliosis and atrophy in the left hippocampus. Now, there is also another finding in this patient that we can see when we go more anteriorly, basally, frontally. We can see substance loss and gliosis in the cortical and subcortical matter due to previous, most likely, contusion injury. You can see it also on the axial slices as the gyrus rectus are missing parts of them with adjacent gliosis. Here is the same area on the sagittal sequence, as well as the same very striking visible on the T2 weighted imaging. Now, the possible scenario could be that patient was originally with mesial temporal sclerosis and has developed epilepsy with seizures, and during such seizures with rapid head movement, there has been resulted in contusions of the base of the frontal lobes, which is a common location for such contusions. So this can be a secondary to epilepsy insult. However, these areas can also be a potential focus for the next epilepsy. So when we evaluate the hippocampi for epilepsy, for mesial temporal sclerosis, we look at the signal density and the volume, just like in this case. There is one bonus finding here. You can see this is from the previous exam. They give contrast, and there is a diffuse about 5 millimeters contrast enhancing a lesion centrally in the pons, no edema in the perifocal area, and on the SWY sequence, the susceptibility weighted imaging, we see low signal, and this corresponds with capillary telangiectasia in rather a typical location, diffused defined slightly enhancing lesion with low signal on SWY. Incidental finding with no clinical consequence. Okay, so if you like this type of the presentation, consider reviewing my other cases, liking and subscribing. See you on the next